Today, we have a very interesting guest, Dr. Jonathan Shaw, MD, from Palm Beach Orthopaedic Institute, the most incredible surgeon I ever spoke to. Stay tuned because this is exciting, going from being an engineer to an orthopedic surgeon.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening. I am Andrea Albertini, the host of Senior Care Made Simple podcast, and I am here today with Doris Muscarella, my co-host. Hello, Doris.
Hello, everyone. Thank you for listening to our podcast. I'm Doris Muscarella, the co-host.
And as you all know, we always love to bring different people to our podcast. And we created this podcast to help adults dealing with aging parents, and as well as providing information to anyone that may need it. We have an amazing guest today, Dr. Jonathan Shaw, MD. He works with Palm Beach Orthopaedic Institute. And I'm just so excited to have him here today. Hello, Doc. How are you today?
I'm doing great. I appreciate you guys having me on. I think this podcast is great. You know, I take care of a lot of older individuals, and as they age, you know, the outreach situation to kind of educate people on their orthopedic needs.
And one of the things that I was excited about having you in the show, because Doris is a golfer. And as you know, Doc, we have a lot of country club and a lot of golf courses down here in Florida.
Yeah, I mean, I would say a good 75% of the patients that I see here in West Palm, especially Jupiter area, but also in Wellington and, you know, downtown West Palm, they're all, you know, as people age, you know, these types of activities, it's normal to start feeling some kind of joint pain that needs to be addressed so that they can get back on the course.
And one of the things that I am excited that I would love to talk to you about is that you have this incredible technique, the rapid recovery and outpatient joint replacement techniques that you use. Can you please share with us?
For 50, 60, 70 years, people have been putting hip replacements in, and we haven't had much advancement in how we put it in when it comes to the actual surgical technique. And over the last 10 years, over the last decade, we've kind of gotten to the point where we can start doing what's called minimally invasive type surgery, where we're not cutting any of the muscle, tendon, and ligaments in the joint that allows the patient to accelerate their recovery. It's even allowed, you know, same day discharge type total joints. Now, I came from a training program where the father of outpatient total joints was there, and he did it, you know, almost 30 years ago. And so he's really perfected that, and I've brought that down here to Florida.
That's amazing. That's incredible. And I know, Doris, you have all kinds of questions for Doc, so you might as well just go.
Especially the lower back.
Yes, that's my problem, Doc. But your background is diverse. If you could give us a little bit about your background.
I used to be an engineer for about 5 years after schooling. I designed hip and knee replacements for one of the major companies. Then I decided to kind of change courses and go back to medical school at that point to become an orthopedic surgeon. And so my goal at that junction was to train in arthroplasty. I was trained mostly in Michigan and then Chicago, and then came down here because my in-laws are down here, and brought the grandchildren a lot closer to them. So I'm fortunate to be here. I specialize specifically in minimally invasive type arthroplasty. I do complex arthroplasty revisions. That's the kind of redos of total joints or total hip and knee replacements. I also do a lot of trauma for hip fractures specifically.
So I am in the, as Andrea said, I'm in the golf space. I love golf. We're in my community. There's about 890 golfers and stuff like that. And the common denominator is the back pain, the swing. And, I say, okay, well, I'm going to exercise a little bit more and work on my core. Doesn't matter how much I work on my core. I still have that back pain after a round of golf. Is there anything that you could recommend, or is this a common denominator in golfers?
Yeah, I mean, I think even if you look at professional golfers, the number one issue that kind of curbs them for the year is their lower back pain. And unfortunately, when you rotate through that swing, there's a lot of torque that goes into that lower back. I think that the most common thing you'll ever see in anyone 50 and above is lower back arthritis. I think that's just the demand of our lifestyles, of our jobs and stuff like that. And so lower back arthritis itself can be controlled conservatively, just like you said, having strong cores and swinging through their swing. All that pressure is going to go into the lower back, or the lumbar spine is what we call it. And that causes a lot of more, sometimes arthritic flares, but also it strains the muscles that keep your lower back aligned. And so a lot of that lower back pain people are feeling is more muscular pain versus arthritic pain, just because they're being overloaded because the other muscles aren't balanced. Some people also don't understand that you have very tight hip muscles, specifically flexors in your hamstrings. Those can cause, an overload in your muscles in your lower back and can throw off that as well. And so proper hip health, proper core health, all of those are going to contribute to leading to a little bit better relief in your lower back. The other, next step, if all of this physical therapy and strengthening and still causes you to have pain to the point where I've golfed 18 holes and I'm out for 2 days because of my lower back pain, those are the times where telling patients to go see someone who specializes in non-operative spine. We call them physiatrists or PMR doctors, and they really kind of get the appropriate imaging, they get the appropriate treatment tail, to the point where then they can say, oh, maybe it's time to see a chiropractor. Maybe it's time to see if they see something, unfortunately, that needs some kind of surgical, they'd be the ones that would be able to direct it.
We also have a lot of tennis and pickleball, and we have a lot of knee injuries. Have you seen that also?
Oh, yeah. I think that what happens is with people who were very active when they were 20 to 35 years old, then they have the stage of not being super active, and then they fall in love with pickleball and they think they can go play 7 days a week with their like a professional athlete, and then all of a sudden they're wondering why their knee hurts. Well, that's because you played pickleball for 7 days.
Yeah.
No, but
pickleball, it doesn't look like it's strenuous, but it is.
And I think that what we consider mid-flexion of your knee, that puts a lot of strain on different parts of your knee. It puts a strain on your kneecap. It puts strain on some of the structures in your knee, like your meniscus. And people who have arthritis in their knee, they don't have pain all the time. They have pain intermittently when it flares up. And you have to think of the arthritis kind of like a pothole in the road. Sometimes you're paying attention and you miss the pothole. Sometimes you're playing pickleball, you're not paying attention and you hit the pothole really well, and then it flares up your knee and it's all swollen and stiff. If it's, a first flare up or something that's not bothering you every day, there's a lot of good conservative management for knee health that we can do in order to get you back onto the pickleball court. If it's for arthritis, conservatively, we can't take arthritis away, but conservatively, we can make your pain better. And by doing that, we make your function better.
Well, that's great. That's great. So I'm also have to say, I don't want to take
Here
over.
she goes again, Doc.
Oh,
That's why I'm letting her speak, just
okay,
so you know.
that's
Because she
it.
has her own agenda.
No, as I love cycling. I'm a cyclaholic, and I do cycling 3 to 4 times a week because I heard that by doing cycling, you straighten the muscles around the knees and stuff like that, so that if you're playing or aerobics or whatever, it's you're stronger, and it helps you with like exercise. Everything is great. What is your opinion on cycling?
I'm, being the arthritic doctor for Palm Beach Orthopaedic Institute, I'm all for any type of low impact activity. Cycling is one of those low impact activities. So we talk about water aerobics, we talk about dancing, we talk about cycling, we talk about yoga. These are the things that keep you active, keep your muscles strong, but also are low impact on your hip and knee, especially hip, knee, lower back, ankles, pretty much at anything downstream. I think that if you're doing an activity like maybe pickleball or running, and it's causing you to have such severe joint pain that you have to skip activity for a week or so, then it's time to try to adjust and find an activity that's not going to cause that problem, but also keeps you active and keeps your muscles strong. I think what a lot of people don't understand is it's also a physiologic problem. As we age, our tendons and our muscles and our ligaments, they all start getting stiffer than those that are, younger. Me now being in 40, like I have to stretch before I'm going to do those types of strong activity. Even when you get into your 70s, it's even more important. So if you're having this type of stiffness, you're having this arthritic flare, you're having problems when you're doing those activities, the most important thing you can do is spend half the time actually stretching first and then going doing those activities.
Yeah, I think stretching is so important too. Especially sometimes you're in the car for 45 minutes and you get out of the car and you're like, oh my God, everything hurts. So it's true. Stretching is so important.
And it's nothing that anyone's ever done. It is literally a physiologic problem that causes your tendons and your muscles and your ligaments to get stiffer.
What are early warning signs caregivers and seniors should not ignore? Like, my mother sits a lot all day. I try to get her up and walk, but she doesn't want to. As a caregiver, what do you recommend that I do?
As we get into the much older ages, octogenarians, 80 to 90, what we really have to focus on is what's called bone health and balance. They're two different things. So bone health is proper monitoring of osteoporosis, even in males, not just females, because those are, if they go unmonitored, what happens is you have someone who has recurrent falls and they break their hip, right? And that could have very well just been prevented from having appropriate, bone health monitoring. That's through your primary care doctor. If your primary care doctor isn't involved in the bone health, then you can get a referral to an endocrinologist that can properly work that patient up. The other thing is, a big warning sign is if you start seeing your family member falling quite a bit, right? That the falls themselves come from so many different, we call it multimodal problem, right? Someone's gait is unsteady. They're limping all around. You start hearing them, oh, I fell last night when I went to go to the bathroom, right? Those are things that you need to start addressing sooner than later because it can get very, very bad, especially with large injuries like a hip fracture. And so that's a big warning sign. If it's joint pain, that's causing the patient not to want to get up from the couch and just want to sit because my hip hurts all day. We have plenty of modalities to get that to improve so that the patient can get mobile again. But if you do see that, mom and dad or grandma and grandpa are sitting on the couch all day and not moving, that's a big warning sign. The other thing we don't talk about, even though I'm an orthopedic surgeon, I'm still going to talk about it, is that older people do get depression. Okay. And if you see someone with a lot of these warning signs of what you would consider, wow, why are they sad all the time? Why are they not eating?
Absolutely. And one of the things that I heard about you is, that the way you do your knee replacement is the recovery. Can you share with us the recovery time? I think a lot of people have a lot of concerns about getting the replacement. How long am I going to stay down? Because I'm sure that now you have seen, especially here in Palm Beach, is a lot of younger people having knee replacement, correct?
Right. Hard conversation to have with patients because a lot of patients are looking for robotic type total knees. But one thing they don't really understand is that the exposure, the actual surgical exposure for a robotic knee is actually more than what a normal knee would be. And so we have to somehow, because robotics is still in its infancy, have to somehow combine this idea of minimally invasive surgery, where what we're doing with minimally invasive knees replacement is we're not cutting any of those muscles or tendons within the knee, and it spares your quadricep muscles in order to increase your recovery time or decrease your recovery time and decrease your pain post-operatively. But at this point, because of the exposure type thing, robotic surgery hasn't been merged with that subvastus approach. It's starting to do that. And I think that myself and some colleagues are going to get there very quickly. I think it will happen within the next year or so. And I think that will be a big advantage when it comes to the new technology as well as the new approaches to a knee replacement. I tell patients around 6 weeks they can go back to swinging their clubs, especially with a knee replacement. It's shorter for a hip replacement, but I have a lot of golfers that are very happy with their knee replacement.
And and I want a lot of the listeners to understand that hip replacement and knee replacement is not because you're elderly. It's not because, anyone and at any age could, is it okay to have a knee and hip replacement? Because I have a friend of mine, Doc, she's I think Elizabeth's about 52 years old. And she just had one hip replacement last year and she's going to have another one. And, and the time that it takes now to be able to recover, it's so much shorter than before. And I think that people are still frightening when you talk about knee replacement and hip replacement. And I really want, the listeners to understand that there's no fear because it can be at any age. And the younger that you do, the better off you are if you're having problems, correct?
Yeah, I think there are a lot of people who are becoming younger and younger and requiring replacement type surgery. Again, requiring is a loaded word because it's arthritis and total joints are an elective procedure. And so the patient kind of tells when it's affecting their quality of life so much that they can't do their activity. They're losing sleep. They're starting to take more pain medication than what they usually do. That's when we're really considering some type of replacement type surgery. And your friend who's in her 50s, even 60s, these are ages where I think arthroplasty itself is becoming more popular, and that's because of the type of technology we have in our implants have greatly improved over the last decade. And I think people are getting longer longevity in their replacement surgery itself, where people can really benefit from that. When it comes to hip replacement, I've done for people who have terrible diseases, I've done hip replacements in a 33-year-old. Yes, I think that hip replacement will eventually need some kind of revision or redo, but if it's properly monitored, those revisions and redos are they're a lot less surgery than the replacement itself.
Wow, that's amazing. And I have actually a client of ours that had her hip replacement when she was 50. And she's a tennis player. She plays tennis and she plays golf and she's very active. And her recovery was absolutely amazing. I mean, in such a short time.
Right. Especially with hip arthritis itself, age is just kind of more of, let's think of the state of their arthritis itself. If you think Bo Jackson himself had hip replacements well before the age of 60 because of the injuries he had on his hip.
And one of the things that I say, I don't know if I'm right or wrong, so you tell me. A lot of friends of mine, I'm 61, so a lot of my friends are 60, 62, youngers, I would say maybe 50, 52, 53, and they are like, oh yeah, let's go skiing, or let's go jump out of a plane. And I'm thinking to myself, are you nuts? I'm not going to ski anymore. I did that when I was in my 30s. I can't afford to break a hip or a knee. But I think that, people should be thinking more, ahead and saying, what should I do and not do? Even though we have, amazing surgeons such as yourself, we still have to understand the consequences, of a bad fall, correct?
I think there's a lot of, grades to skiing itself, right? And I don't think, a 65-year-old should really be going off the half pipe for, up in Colorado. There's not a lot of differences between jumping out of a plane. So I don't know if that's really for patients that are in that hip fracture age group. There's a lot of exciting things you can still do besides jumping out of a plane. But the biggest thing for me is I don't like to tell people they can and can't do things, because I think that leads to inactivity. I do think that people have to be conscientious of their body. I think that if you're doing something and every single time you do it, you're hurting for 2 weeks, that's probably a little bit too hard on your body at that point. And so I think that encouragement for doing new stuff, encouragement for doing new activities is important. But I think that we have to also be a little bit realistic.
And also, I wanted to mention to the listeners is that, we are in Palm Beach, Florida. And if any of you, because we have listeners all over the world, and if any of you would like to consult with Dr. Shaw, or have surgery, come to Palm Beach, Florida, have surgery with Dr. Shaw, I'm sure, you'll be very, very well taken care of. We're going to have some information for all of you and how to contact Dr. Shaw and Palm Beach Orthopaedic Institute. So I just want the listeners to know that, because I know that sometimes you guys have patients that, because I know you practice for a very long time, Dr. Noble and all of that. So you are together with them as well, correct?
Yeah, our practice has been around now for 50 years. So there's obviously a big history here in Palm Beach. I think that some of our, we have gotten to a point where we're bringing newer techniques into Palm Beach, because I think that was lacking for a very long time with some of our providers. But I do think that Palm Beach Orthopaedic Institute is probably one of the rare private practices around the country that does very, very good surgery and have been doing it for so very long that they have such a good stake in the community. But not only that, because Palm Beach is unique in the sense that we have snowbirds that come from all over the world to stay here for 6 months. And every one of those snowbirds have probably a living situation down here that's better for them to recover from surgery than what they have, say, in New York City, that a lot of them are asking for their arthroplasties and their surgeries to be done down here so that they can get the proper physical therapy at home. We have very good ability to accommodate anyone who comes in. I've done, patients who've flown in from Nashville, Dallas, people who've driven down from Orlando, or we get them set up so that they can stay in appropriate hotel where we have contracts with hotels where physical therapists can come in and help them and then travel back. People worry about flying after their surgery, but research has been shown that flying even after a couple of days is safe for them to do. And so I think that this location itself is prime for someone who is looking for what we consider destination arthroplasty. And destination arthroplasty is becoming a big deal in the sense that people traveling to a place that's easier to recover, or that they just want to enjoy the sunshine while they recover is something that is becoming talked about a lot more.
And actually, I used to live in Philadelphia. I'm from Brazil, but I was living in Philadelphia since I was 17 years old. So I've been in Florida, in Palm Beach here for about 24 years. And I know for a fact, knowing most of the physicians at Palm Beach Orthopaedic Institute, every one of them are incredible surgeons, incredible physicians, and you guys are one of the best in South Florida. So I can say that because I know for sure.
We work really hard for that reputation and have been working really hard. And I think that the selection criteria for being able to join the group is very stringent. People are very protective of the name. They're very protective of the practice. And because of that, when we select someone, they already know that person's going to be a very good surgeon, and they're not going to have an issue with it. And so I think that's why the name has been around for so long. I think that's why the reputation is so good.
And that's amazing. That's wonderful. Well, I thank you so much for coming to the show and share your amazing expertise. But I got to tell you, I really love the fact that you were an engineer before became a surgeon. I mean, that's brilliant.
That's awesome.
That is absolutely brilliant because right? Yeah. Because you know the engineering of things before you became this amazing surgeon. So this is pretty incredible. So thank you so much for coming in the show, and we appreciate having you.
I truly appreciate you guys having me. Let me know if anyone has any inquiries or any questions. We're happy to help them here in Palm Beach Orthopaedic Institute.
Thank you.
Absolutely. And if any one of you that's listening to the show are interested in talking about anything or having us talk about anything or come on the show, please email us at seniorcaremadesimple@gmail.com. seniorcaremadesimple@gmail.com. Thank you for joining us today. Thank you, Dr. Shaw.
Thank you for your time.
And thank you, Doris.
I'll be calling him when I get back injuries.
And everyone, have a great day.
Thank you.
Thanks, Doc.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.